Now NBC5 responds. This week, we've introduced you to two people in our community who suffered life-changing medical emergencies. And when their insurance companies denied their coverage, they found roundabout ways to get their claims covered.
Sometimes that's what it takes. NBC5 Responds investigator PJ Randhawa shows us how to increase the odds of getting your health insurance company to pay for your claim even after it's been denied.
When his health insurance company denied medical claims for his son's hospital stay, Brandon Kennedy got creative.
And I called my local union.
He went to his union's health trust, which overrode the insurance company's denial. It saved him tens of thousands of dollars. Then there's Jessica. At age 35, she was diagnosed with stage 4 colon cancer. When her insurance company denied coverage for Jessica's treatment, her employer's HR department helped her get approval.
Really advocate for yourself, and that's what I've done, and hopefully that's what other people can see and maybe do for themselves.
But the majority of Americans don't go to the lengths Brandon and Jessica have to get their denied health insurance claims approved. In fact, a new analysis of ACA marketplace plans by the Kaiser Family Foundation found less than 1% of denied health insurance claims were appealed in 2023. According to an analysis of federal healthcare data by Value Penguin, of all the major insurance companies, those with the highest denial rates include United Healthcare with a 33% denial rate, Molina Healthcare at 26%, Anthem and Medica both at 23%, while Aetna's at 22%, and Cigna has a 21% denial rate. The data does not include employer plans, Medicare or Medicaid.
You have to fight for your rights and never give up.
Adria Goldman-Gross is the founder of MedWise Insurance Advocacy, a group that helps patients appeal denied medical claims.
If you have a problem with the bill, the first thing you really should do is call the medical provider, call your insurance company, see why they're not paying it.
Goldman-Gross says if the insurance appeal process doesn't help you, she's seen success with the strategies Brandon and Jessica used, asking your union or company's HR department to contact the insurance company on your behalf. If you're not in a union or you don't have an HR department, she says go to the state.
The departments are the Department of Insurance, the Attorney General.
And if you still don't get anywhere and you need to pay your medical bills, call the medical provider's billing department and ask to negotiate a lower fee. There's a trick to this. See what the Medicare rate is for whatever procedure you were billed for.
Normally, an insurance company never pays out more than 160% of whatever that Medicare rate is.
Calculate 160% of the Medicare rate for your procedure. Gross says that's the amount you should offer to pay your provider.
Normally, not always, but normally they will accept it.
NBC5 Responds reached out to the insurance companies named in this story. United Healthcare told us in part, the assertion that United Healthcare denies 32% of claims is out of context and misleading. It does not reflect UHC's overall claim denial rate as stated above. The figures you are asking about are based on data UHC provided to the Centers for Medicare and Medicaid Services for individual and family plans in 2022, representing less than 2% of United Healthcare's total claims. It is important to note there's a lack of standardization in the industry regarding claim protocols. Cigna tells us in part the most frequent cause of avoidable prior authorization denials is submission errors, including incomplete information submitted by the physician's office. When we do not receive sufficient information, we attempt to obtain the missing information from the requesting physician. If our attempts are not successful, regulatory requirements require us to issue a denial. We've posted the company's full responses along with the story on our website, nbcchicago.com/consumer. PJ Randhawa, NBC5 Responds.